Aligning Forces for Quality is the Robert Wood Johnson Foundation's signature effort to lift the overall quality of America's healthcare system in 16 communities across the country. The Robert Wood Johnson Foundation, more than 7 years ago, made a large investment in to improve the healthcare system across the country, and it really was about the fact that Americans weren't getting the right care, nor were getting the value of care that we needed and deserved. Aligning Forces for Quality is really unique because at the core of it, it embodies the idea of a multi-stakeholder alliance. That means consumers and patients, employers, purchasers, health plans, hospitals, and physicians coming around a common table working toward common goals. So alliances come together with multiple stakeholders around a common table, and they really work on several different core aspects of Aligning Forces for Quality. That could include performance measurement, public reporting, quality improvement, payment reform, and engaging consumers to really drive change throughout the marketplace. As I mentioned, consumers have been an integral part of Aligning Forces for Quality, and they've played multiple different roles, but one of their most important roles is really working on selecting the measures that go ultimately on the public reports, and so that information that is made transparent to the public is really consumer friendly. It is user friendly, and consumers not only have played a role in selecting those measures, but also they play a critical role in how those measures are displayed. That can be really important to understand the quality and value that ambulatory care providers and hospitals are giving to patients day to day, hour to hour, and really understanding how to improve and where to improve the quality of our healthcare system. So I think one of the important questions is understanding how Aligning Forces for Quality has driven the pace and scope of change in these 16 different marketplaces. And one of the core aspects of that is really uniting and driving the demand side of the market, and that in many respects is the consumer and the employer side of things. Consumers in particular have been a voice for an expanded scope of the project and a faster pace of the project. And that really is key to the success of Aligning Forces for Quality because, as we know, change is hard, change can be slow, and having those counterbalances and having a honest and forthright discussion about not only what's changing, but how fast it's changing has been a really important part of both Aligning Forces for Quality, but also central to the consumer and employer role in the project itself. Our meetings and convenience as we've brought together the 16 communities over the course of the project has really evolved as the program has evolved. So in the early days, we really focused on the how-tos, how alliances were selecting measures, how they were displaying measures, their early efforts around payment reform. The last, I would say, year or two really has been around helping the alliances think about how to sustain their work going forward post-2015 when the Robert Wood Johnson Foundation funding ends. That's really about building capacity, it's about developing skills, it's about increasing a knowledge base. It's really about bringing people together not only to forge stronger connections with each other, but stronger connections between the communities so that they can be a network in and of themselves and really have an enduring legacy going forward. So I only wish I had a crystal ball to understand the AF4Q legacy. But if I was a betting woman, I think those 16 communities are going to have a sense of quality improvement baked into the DNA of their healthcare system. I think they will have an ability to take the work that our Robert Wood Johnson Foundation has invested in and take it to the next level. I think they will go deeper, I think they will go faster, and I think they will spread their work not only to the healthcare system, but also to population health and really embrace a new era that the federal government and the private sector is driving toward, in which accountability, transparency, and where payment rewards value and not volume.